O'Reilly! Check engine light on? Take the guesswork out of your check engine light with O'Reilly Veriscan. It's free and provides a report with solutions based on over 650 million vehicle scans verified by ASE certified master technicians. And if you need help, we can recommend a shop for you. Ask for O'Reilly Veriscan today. O'Reilly Auto Parts.
Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hey everyone, it's Susan Kaufman. I am here with Attitude Magazine's ADHD Experts webinar series. Very interesting topic today. You may know that as many as a quarter of all people with ADHD also have an anxiety disorder characterized by very excessive fears and by panic attacks. And at the same time, children with ADHD are 20 times more likely to exhibit some of the signs of autism spectrum disorders as neurotypical children, symptoms such as social delays, communication problems. And when you're the parent of a child who has more than one condition, which is very common with ADHD children, it can be seriously difficult for parents to understand what's going on, what's causing a child to struggle, and how specifically to help them, given overlapping symptoms and diagnoses. We are so fortunate today to have our speaker, Laurie Better Perlis. Dr. Perlis is a licensed psychologist who specializes in the evaluation and the treatment of childhood anxieties and sleep disorders such as OCD, generalized anxiety disorder, social anxiety disorders, and in the evaluation and treatment of individuals of all ages with disorders such as ADHD, executive functioning challenges, autism spectrum, and related conditions. Dr. Perlis has degrees from Johns Hopkins and Yeshiva University in New York City and practices with Psychological Resource Associates in Maryland. Their website is www.pra-info.com. Dr. Perlis will be offering some specific strategies to help parents of children with multiple diagnoses learn how to differentiate between the symptoms of each one, how to help your child overcome some social hurdles, what behavioral and academic strategies work best for children with multiple diagnoses, and lots more. We are so grateful to our sponsors. They allow us to present all the information that we present week after week at absolutely no cost to our listeners. So we thank them, and especially this week's sponsor, NEBA, N-E-B-A. It's a brainwave test, the first one cleared by the FDA, to help clinicians determine if the child's symptoms are due to ADHD or another condition. Along with, obviously, traditional diagnostic workup for ADHD, NEBA can help clinicians understand better what's causing a child's symptoms. It may confirm ADHD, or it may prompt clinicians to look for other causes of ADHD-like symptoms. So for more information about NEBA, visit www.nebahealth.com/am. Thank you again, NEBA, for sponsoring our webinar today. So with that, let me turn it over to Dr. Perlis again with our thanks.
Thank you very much, Susan, for that introduction, and thank you to everyone for joining today. I'll give you a second to just take a look at that cartoon. So for anyone that may not be able to see that, it's a woman, potentially a mother, sitting on a chair reading a book called How to Raise the Perfect Child, while her young child stares up at her, wanting attention, and she says, without looking up, "Not now, dear, I'm busy." So I think this cartoon is kind of funny, and it speaks to how much pressure we can feel as parents to raise the perfect child, especially in this day and age, or just not to mess up. And in the process, sometimes we forget just to sort of listen, pay attention, and be present. And of course, this can be magnified when our children don't develop as expected, have some difference, are diagnosed with a disorder that makes them just more challenging to parent. So not only is there not a guidebook for a typical child, but there's certainly not a perfect guidebook for a child with differences. Wouldn't it be nice, though, if there was a guide? And thinking, the title of the presentation, Guide to Managing, when your child may have one or more of these disorders, wouldn't it be nice if there was a guide? I would be happy to write one if it was possible. But I think one thing I want to make clear from this webinar is that there is no single parenting book out there, and there are many, and I don't anticipate there ever being one that's really going to capture the unique experience of raising your specific child. there has long been a saying in the autism community that if you've met one person with autism, you've met one person with autism. And I certainly think the same thing could be said for ADHD and anxiety. And I think it's important to recognize that as parents, we are the experts when it comes to our children. And it is the information that we can provide that is crucial in writing our own guidebook to our child and how they operate, what's going to work for them, what's not going to work for them. And I've had several families that I've worked with over the years that have literally written a guidebook and handed it to teachers during the first week of school. This is how my child operates. This is what works. This is what doesn't work. And it's been really helpful. So again, want to emphasize each child is unique. There is not one size fits all when it comes to diagnosis or treatment strategies, and that as parents, you really are the true experts. So ADHD and autism spectrum disorders are both considered neurodevelopmental disorders, meaning that they involve brain function and that they are developmental, so they have sort of always been present throughout development. And now they are understood as distinct conditions that can and do quite often coexist. And this is a relatively recent change. Up until 2013, our diagnostic manual would not allow us as diagnosticians to give a child a diagnosis of autism spectrum disorder and ADHD. It was assumed that any of those symptoms, ADHD symptoms, were just part of the autism. So thankfully, there has been research really demonstrating that that's not the case, and it's ushered in a new era of examining and research into this area when these disorders coexist. And what we've learned is that there are a lot of shared symptoms, some examples: inattention, hyperactivity, repetitive and restricted patterns of behavior. And we've also found that there's a shared genetic link. The two disorders tend to run in the same families. There are similarities in brain differences and brain dysfunction, and neuropsychological correlates have been found. The differences that helps us distinguish between autism and ADHD is more the communication and social relatedness. That's more characteristic of autism, and it can be found in kids with ADHD, and it is found, but it's less characteristic. So that's one area that research has helped us to see can distinguish between the two disorders. I think the takeaway here is that this research is still in the early stages, and even experts in these fields are grappling with how to accurately make these distinctions. It also speaks to a broader debate in the field regarding whether we should continue to rely on these distinct diagnostic categories versus a more dimensional model, which really focuses on what specific symptoms or traits is this child exhibiting and how does it impact their functioning. I think this speaks to a lot of times parents have concerns about labels. And so we're thinking about, when are labels useful? Why do we need them? Are they accurate? And how can we have value in them, but also not rely on them? I do think personally, in my clinical experience, focusing on specific symptoms and traits is much more on a daily basis useful than focusing on a diagnosis. Just knowing a diagnostic label tells us something, and sometimes it's really crucial to have those labels, but it's not enough. We really need all of this detailed data about our child to write our own guidebook. Okay, so initially this talk was supposed to be about the overlap of autism and ADHD, but as soon as I sat down and started thinking about it, I thought, how can I talk about these two disorders without also talking about anxiety? So this visual is a little bit hard to see, but it's kind of showing you this cycle that occurs. When ADHD affects how a child is thinking and processing information, picture a classroom environment. They're trying to take in instruction that's verbal, auditory, and then perhaps they're having some attention problems, they're feeling confused, they're feeling lost, and this can create some anxiety, especially, let's say the teacher calls on them and don't have the right answer, don't know what's being discussed. So we all know that when we feel anxious, it can be very hard to think clearly. So then thinking, processing is further affected, which only leads to more anxiety. So this is a cycle that can occur. Many children with ADHD and autism spectrum disorders experience anxiety in this way, so anxiety symptoms, or often they may have a separate anxiety disorder, such as OCD or generalized anxiety. And this, I think, is really important because it's generally the anxiety and the behavior it leads to that is most problematic and generally brings families in for treatment. So one of the first things that I teach kids and families is about anxiety, and that anxiety is not the enemy. Anxiety is actually a really helpful and essential function in our brain. So it's our internal alarm system, and I explain how it activates our fight, flight, or freeze response. So if you're not familiar with that, if you think about a caveman out in the open running from a bear, so our body is designed, our brain creates this reaction, our body is designed to either fight, run away, or play dead to survive that attack from a bear. So this reaction is still very present in our brain, and it still occurs on a fairly regular basis, but obviously we're looking at different sort of dangers. We're not looking at life or death necessarily, but we're looking at situations where we may feel vulnerable or in danger of being embarrassed or in trouble and things like that. And that can look very different, the different fight, flight, or freeze responses. So how do I get an accurate diagnosis, and why is it important? I think in order to get an accurate diagnosis, especially for kids that have sort of overlapping symptoms, complex profiles, I often hear from families, he got a diagnosis of ADHD, but there seems like there's more going on. You know, the medication's helpful or this treatment's helpful, but there's still some other things that we can't really understand. So that's where sometimes you do need to see a specialist and have a more comprehensive evaluation. So that may be a psychoeducational evaluation or a neuropsychological evaluation. And if people have further questions about those different evaluations, I'm happy to discuss that. So that's usually, we need all that information, that detailed information, to start forming our guide about this child. Without understanding the source of the child's struggles, is it anxiety? Is it because of the autism? Is it ADHD related? How do we know the best way to help them? And there may be effective treatments out there that we haven't tried because we didn't realize that this was an issue. So it is often very important to get an accurate diagnosis, often key. Also, sometimes getting an accurate diagnosis is important to accessing certain services or to work with the school to identify the best educational plan for the child. And sometimes it's just really helpful, especially with the anxiety, I find when people can start to understand that aspect of the child, they can really do a better job of understanding where the child is coming from and responding more effectively, motivating them more effectively. And having just more success in general. So having all this detailed information, not just the labels, but really about the specific symptoms and traits and how it impacts the child's functioning, this is what's going to inform our guides to parenting and teaching this child more effectively. I think it's also really important when you have these overlapping symptoms or disorders to have a team that are all contributing to an ongoing understanding of the child and developing strategies that are really tailored to the child and what his or her needs are. So the team may be parents and teacher. It may be parents, grandparents, teacher, speech pathologist, psychologist, psychiatrist, developmental pediatrician, neurologist. Every child is different, and it may change over time as far as who's on the team and what the needs are. So some of the information that I think is really essential to include in this guide and this understanding of your child is, number one, what are the behavior challenges? So thinking about what's happening on a daily basis. What are our kids doing? What are we seeing at home? What's happening at school? What's happening out in the community? Especially those things that are really significantly impacting the child's functioning and comfort level and happiness, as well as the family's functioning and, of course, the classroom functioning. Behavior is usually one of the most pressing concerns. It's often the reason that people come in for treatment. But behavior is sort of an outward sign. It's sort of the last step in a chain reaction, and it's not necessarily the problem itself. It's more of a manifestation of the problem. So, for example, let's say a child is asked to get dressed for school. He may throw a fit. He may ignore the request, or he may just go to his room and hide in his closet. So what's the real problem here? Obviously, the behavior is the problem for the parent who's trying to get the child out the door and to work on time. But what's the real problem for the child? Is he having anxiety at school, and so he's trying to avoid or delay having to experience that? Is it more that he has struggles with transitions, moving from one activity to the next, feels very uncomfortable? Could it be sensory issues? That's another area that I would even add to this talk in terms of things that overlap. So maybe he's really sensitive to the feel of his clothing, and it's really a struggle to change from his comfortable pajamas into his clothes. Or, something as simple as he was up all night, did not get a good night's sleep, and is just so tired. So we have to look what kind of reaction is happening. Is it a fight reaction, tantrums, meltdowns, more of a flight, non-compliance, or more of a freeze, just that shutting down, kind of hiding in the closet, not talking? So those are all challenging in their own way. And some kids may, sometimes it's a fight reaction, sometimes it's a flight. It really depends on the day, it depends on the situation. So we also need to make observations for our guide about the child's social functioning. So are they having difficulties making friends? Do they tend to isolate, avoid other children? Do they have a hard time when they're expected to work in a group? Do they just interact inappropriately, say awkward things? Again, these are outward signs of a problem, but they don't tell us what the actual underlying problem is. So if a child is withdrawn and doesn't have a lot of friends, is that a lack of interest that we might associate with autism spectrum disorder? So maybe they're more content to play by themselves, which is not true of all kids on the autism spectrum, but of some kids can be somewhat true. Or is it more of an inattention where the child is really hyper-focused on area of interest and happy to focus on that and has a harder time, cooperating and taking turns and not always playing his game? Or is it anxiety, a fear of being embarrassed or a fear of being excluded that keeps them from entering into play with other peers? And as far as awkward social behavior, is it a lack of awareness of social norms, social expectations that we would associate with autism? Or is it, an ADHD related issue where the kid just doesn't know when to stop, that lack of impulse control? Or again, it could be anxiety. Think about when we feel anxious, we tend to act a little bit awkward. We may laugh more. We may just not be comfortable speaking in our normal way. So it can be any one of those things, or it can be a combination. Conflicts with peers. So this could be a misinterpretation. A lot of times kids on the spectrum misinterpret social cues. They may have difficulty distinguishing between teasing and playfulness and bullying. It could also, again, be impulse control and attention, not really being aware of what's going on around them, blurting out something that's not at all related to the topic at hand. Or again, it could be anxiety. And then moving on to the classroom. So if you can't see this cartoon, this really speaks to, I think, a lot of kids that I see with all of these disorders that have a very black and white way of thinking. So it says, just a darn minute. Yesterday you said that x equals 2, and now the teacher is showing that x equals 3. So it's just this idea of they're trying to understand the world around them, and sometimes it's very hard for them to understand the nuances when they tend to be more rigid and more black and white. Something is either yes or no, it's right or wrong, black or white, as opposed to recognizing kind of the nuances. So some of the learning challenges that we might notice, these outward signs, is inattention. So if a child is having trouble paying attention, seems to be missing things, it could be external distractibility, distracted by a neighbor's pencil noises, the sound of the heat, classroom noise from another classroom. It could also be internal distractibility. So that could be anxiety, if a child is worrying about what's coming next or about their performance, or am I going to get called on? Then they're distracted by those thoughts. Or it could be the internal distractibility that we would associate more with kind of a restricted interest or a hyper-focusing. So maybe, there's a child on the autism spectrum or with ADHD who's thinking about this really awesome TV show that he saw, and he's playing it over and over in his head, or thinking about a really cool invention that she wants to make when she's older, and so that's what's causing the inattention. So we have the outward sign, but we need to know what's actually going on. We also see problems with effort. So that can be a symptom of ADHD and sort of executive functioning weaknesses. It could also be a fear of failure due to anxiety. So I'm afraid of failing, so I don't try. It could also be sort of a lack of that of pressure to please and to perform well that we might expect more from a child on the autism spectrum. Or again, it could always be an overlap of some of these things. And weak executive function, so that's things like organization, having their materials all over the place, working memory, so being able to keep instructions in their head and follow multi-step directions. So these certainly can be seen in all three disorders, and trouble getting started without support. And again, all of these things could be coming into play. And certainly we know that children are more challenged and have more difficulty when they have difficulties in more than one area. So it's really up to, I put expert analysis and with parents in parentheses because again, you are the experts. So we see these outward behaviors, we see the signs that something's going on, and we know it's causing problems, but how do we determine the underlying cause? Is it the ADHD? Is it the autism? Is it anxiety, or some combination of one or more of those? So we need data in order to do that. We need to look for clues and signs. So we may need to look to the comprehensive evaluation. We need observations from school. We need our home observations. We also need to ask the child. When our children can participate actively in this process, it is very, very helpful. When they're able to articulate their experience, then we can really, really flesh out our guide of to what makes them tick, what's going on. So the things we want to collect as far as the data, when is it happening? So these are challenging behaviors, whether it's not following along with the daily routine or throwing a fit. When is it happening? How often? How long does it last? And what are the possible contributing factors? I always like to think of things we can control first. So are they tired? Are they hungry? Were they involved in a game that they really love and it was very hard to transition? Because there are also a lot of things that we can't control as easily. So we take all this information and what we do is just make our best educated guess, and we create hypotheses about what we think is the underlying cause of the problem. And then from there, we develop a strategy and see if it works. And it's a lot of trial and error. And that's a lot of what I'm doing with families in treatment is trial and error. We have sort of a menu of strategies, and we pick one or two that we think make the most sense. And then we find out what happens and we troubleshoot. So as an example, maybe transitioning from playing to bath time is really hard for a child. It could be inflexibility that we associate with executive functioning challenges. So maybe that's where it's coming from. So then we would want to give a warning and try to use a transition activity, for example. So I had a family where they would sing and dance on the way from the activity they were doing to the bath, and that seemed to be helpful. However, if it's a sensory issue where the child is avoidant of the bath because it feels very uncomfortable, then those tools may not be as effective. We need to think about tools that are specific to that child's struggles. So this is just a helpful tool in analyzing a child's behavior. This is often used in classrooms to determine the causes of a behavior. So we're looking at the antecedent. Well, first of all, the behavior, the B, is the outward sign. So what is it the tantrum, the noncompliance, the inattention? What's the behavior that we're seeing? What's the antecedent? So that can be, it's sort of the last straw or the trigger, the thing that happened right before the behavior. But it may not even be the true cause of the behavior. Often, we really need to look before the antecedent. So what were those circumstances leading up to that event or to that antecedent? So it may start that morning. It may have started the night before with not getting a good night's sleep or being frustrated with a video game. So we really need to think about what's going on in the child's world that may have built up over time and led to this chain reaction. And it's also really important to think about the consequence. We're trying to figure out what function is this behavior serving. So, for example, if the child is asked to do something he doesn't want to do and he throws a tantrum, consequence is he doesn't have to do that task, then he's using that behavior as a tool. Maybe not consciously, but that's kind of how behavior works. So some of the most frequent functions of behavior are to get attention, get help, or to escape or avoid something that feels overwhelming or too difficult or too anxiety-provoking. So this picture, I think, just represents both how, as parents and professionals, we may feel when we're working with really complicated kids and trying to tease out where these difficulties are coming from and how we can best address them. It can be very hard to understand, very hard to predict. I see kids where we use the word inconsistent a lot because, may be able to manage something one day and then the next day, same exact situation creates a meltdown. And some strategies work one day and not the other. So it can be very frustrating, very overwhelming. And I think that brings back to this idea of needing a team to work together. But I think it also captures this idea that our children experience sometimes if we don't have an accurate understanding and an accurate guide of what they need to be successful, we may be putting them in situations where they can't manage. And that's often when problems occur, when the demands are too much, whether it be the demand for them to sit in a chair still for 20, 30 minutes, or to sit in a loud, noisy lunchroom with all of that noise, or academic demands. The speed of it may just be too much for them. So our kids may be in over their head, and if we're having a lot of challenges, we need to think about that. And what can we do to support their differences and make them feel like they can manage? Strategies. So like I said, there is a menu of strategies. And I think the anxiety is often the most pressing thing to address because it can really significantly interfere. It leads to the fight, flight, or freeze response. And once that happens, it's very hard to come back from that. You sort of have to wait it out. So when we have an accurate guide and understanding of our child, we can start developing strategies to try. So some of them are just going to be modifying things in their environment when possible. So if you know a child is likely to have an alarm reaction to an unexpected change in the schedule, we can make sure they have a big family calendar, visual reminders of what is happening throughout the day. There are things we can do to modify their world, modify their environment to decrease their anxiety, so they know what to expect. We also need to manage our expectations of what they can manage. So, and that across all areas, social, academic, behavioral. Maybe a child does really well on one-on-one play dates, but really is not ready to handle large group birthday parties or unstructured, unsupervised neighborhood play. So with some families, we've worked out strategies where the child goes out into the neighborhood for that unstructured play, but carries a walkie-talkie and has periodic check-ins and takes breaks when it seems there's conflict arising or he's starting to get frustrated. Sometimes it's just a matter of taking breaks and keeping the time limited so that it's a successful experience and it doesn't create more anxiety and stress. And often, as part of this, part of that team would be a therapist, a psychologist. Part of that team is often someone who can prescribe medication. So in many cases, the anxiety is so significant that it really affects a child's ability to function, and it also affects their ability to participate and benefit from therapy, from behavioral interventions. So that's when medication is really helpful. So in thinking some of the specific strategies that I teach to children and families, I talk a lot about the brain, and this is titled Worry School because I had a patient who decided to go home and create a worry school where she taught her younger sister some of this information. But so I use the idea of a thinking brain and a worry or feeling brain. So we want them to have a language to understand their experience. And when things are going well, the thinking brain and the feeling brain are in regular communication. So I have a strong feeling, this doesn't feel good to me. My thinking brain says, well, it's okay, you did this yesterday, you'll get through it. So that's what we want to happen, but often that doesn't happen. And sometimes it's a matter of we need to stretch the muscles, so to speak, of the thinking brain. We need to practice. We need to give children specific tools that they can use in their thinking brain. So sometimes that may be thinking about what's really true and using logic, looking for clues for and against the likelihood of something bad happening, and other strategies like that. So often just giving them the language and some strategies can be really helpful, and for parents as well. So one of the things I mentioned previously is that inflexibility can be very difficult to manage. And so a lot of, I work with kids where it really is, if you can see the cartoon, it's a rock, a hard place, and there's a little wiggle room in the middle. So often it's really hard for these kids to find that wiggle room, and they get stuck. So that's an area that's really helpful to work through with them. And it takes practice, teaching, reminders, and going through a step-by-step process of how do you think about a situation from different perspectives? How do you problem solve and come up with different options? So what I often do with kids as well is there are some great apps that teach mindfulness and breathing strategies. So deep breathing, ways to focus on what's going on in your mind and, watch your thoughts pass by. Yoga and exercise are also really, really important things to try on that menu of strategies. And social strategies. So this picture is a book by an author, Julia Cook. She has a whole series on books that I find really funny, helpful. Children love them. This one's called A Bad Case of Tattle Tongue. So this is when we're looking for social learning, and we need to teach our kids about some of the social expectations and the consequences of their social behavior. So there's some great books by this author and by other authors that kids really enjoy, and it's also informing them of some of the social expectations. It's also, I think, important to set realistic goals and based on that child's interests. So often it's a matter of, well, my child is perfectly happy playing with just one friend, but I sort of wish they had more friends. So it's finding that balance between encouraging them to expand their world, but also recognizing what their goals are and what their comfort level is and what they're motivated to do. I think it's very helpful for kids to develop social connections and get engaged in social interactions based on shared interests or activities. So it's more of a structured situation. Kids across the board with ADHD, autism, and anxiety tend to do better when they know what's expected. There's a clear beginning, middle, and end to an activity. And they know there will be people around, there's supervision, there's adults involved to keep things moving in a positive direction. And this is a social thinking curriculum that I often use, created by Michelle Garcia Winner, a speech pathologist. And so Superflex is this superhero who is flexible and thinks about others, and he always sort of saves the day. And then the other creatures surrounding him are the villains. They're the unthinkables. So some of the ones that I use most often, I would say, are Rock Brain, who makes people get stuck on their ideas. Glass Man makes people have huge reactions to small problems. Energy Harry, he gives people too much energy. So see, these have actually storybooks that go with them and activities that go with them. And I find that kids younger kids tend to really enjoy these. Sometimes they'll come up with their own unthinkables, and it can be a really good tool for pointing out certain behaviors that are challenging and helping them to have a better understanding of social behavior. And then just as far as school, and in general, setting clear rules, expectations, and consequences. And sometimes we need to be really, really specific and concrete, especially with social boundaries. So maybe it's okay to high five when you do well or when you're playing a game, but you don't want to high five more than 2 times. Then it becomes awkward. So having really clear rules, using a lot of visual support is helpful. We need to modify the learning environment. Classrooms tend to be more one-size-fits-all, which often doesn't work well for children with differences. So in order for them to fully benefit from their education and learn, they may need accommodations in a 504 plan or an IEP, anything from extra time to movement breaks to specialized teaching. And And it's really important to focus on the strengths of that child and include that in the guide. So what motivates the child? What do they love? What are they good at? And find opportunities for them to show that off and build confidence and take a leadership role in among their peers. Because, our kids that are having difficulties in these areas are more often getting negative attention as opposed to positive attention. So we always want to look for ways to build them up, build their self-esteem, and build their esteem among their peers. Because they often have so much to offer, and it's really important that they're able to demonstrate those strengths as well. So just this last visual I will leave you with. I think we've talked about that this overlap is really difficult to make clear distinctions among the three disorders, and maybe that's not the key anyway. Maybe it's more helpful to just focus on the specific symptoms, what's going on with that individual child, and developing a guide and strategies based on that. And keeping in mind that successful strategies are really built on a step-by-step process of learning. Sometimes it may feel like 2 steps forward, 2 steps back, but that's really the nature of it. And I would reframe it as we took a step that the child wasn't quite ready for, so we just need to backtrack a bit, and then we will be there. And each step of the way, we're building resilience and we're building life skills for that child. So I will open up for questions, and I apologize for going over time.
No, so really interesting and very much appreciated by the listeners. Before we get to some of the strategies, maybe we could just backtrack for 1 second to the diagnosis. You mentioned ways to clarify your child's diagnosis, and there are some questions about that. One thing people are asking, is it really worth having a separate diagnosis of ADHD separate from ASD? Why does it need to be separate? Can it just be part of an ASD diagnosis? What is the significance, I guess, of having these individual diagnoses? That's part one. And part two is, you mentioned that you could clarify psychoeducational, neuropsych, the different ways that children are diagnosed, and there's a lot of interest in understanding more how especially comorbid conditions are diagnosed. Special ed testing, what are the options?
Okay, so why do we need 2 different diagnoses? I think, so before, when we weren't even allowed to diagnose ADHD in kids with autism, I think a lot of us as clinicians felt that we had to really overemphasize, because we want people to understand that this is something that's impacting the child. The fear was, if we write a report that's given to a school and it doesn't really emphasize that these are really significant symptoms that are impacting the child, they won't be addressed as prominently. So I think that's what's really important about, and whether you say it's ADHD, so I do feel like it was effective as long as we could emphasize that these were the symptoms that were co-occurring. Not necessarily essential to have both of those labels. Okay.
Although one person writes that school systems may require that diagnosis to move forward with a screening for 504. So sometimes accommodations might be easier to come by if you have a diagnosis. That was a comment.
So that's why I mentioned sort of that, unfortunately, sometimes you need that the documentation of a label to access certain services or certain accommodations or certain processes. And that's an example. I've been told many times by school personnel that a diagnosis does not drive the services for a child with a 504 or an IEP, but every school is different. It's not really standardized how that whole process works. So a parent may go into a school and may be told that. And yes, often they do need some diagnosis it sort of is the starting point of that guidebook of what are we doing for this child. So, and as far as the evaluations, so there are psychological evaluations, psychoeducational evaluations, neuropsychological, and then there's kind of hybrids. The type of evaluations that I do are sort of a hybrid, where I'm looking at psychological functioning, I'm looking at thinking, intelligence. I'm also looking at academic functioning, so testing math, reading, writing. And then I'm also looking at more neuropsych brain functions like attention, memory, executive functioning. things like that. So it's really a broad-based look at how is this child functioning across a lot of different areas, emotional functioning as well. How is this child functioning across all of these different areas? And we're getting actual data. So compared to other kids, thousands of other kids, his or her age, here's how he's functioning compared to them. And so it gives us, this is the detailed information we really need to understand what areas are they doing well, what areas are they struggling, and how we can, this is the material we use to develop a 504 plan or an IEP or a treatment plan for that matter. So often, especially in more complex kids, we need that level of data. Not all the time. Sometimes a really good sort of working consultation with a psychologist and communication between home and school, you can get the information that you need. But sometimes you do need a higher level of information, especially when there's when there could also be learning issues that you have to rule out. Does that sort of answer some of the, go ahead.
Well, I think one of the questions is the educational evaluation, I guess is called sometimes the neuropsych or the psychoeducational evaluation. It's my impression that doesn't necessarily evaluate things like anxiety or executive function as much as it does learning disabilities or learning issues. Is that correct?
So this is not, unfortunately, this is not standardized across the field. Okay. So you may, certainly school evaluations are really more focused on learning, and that's more of a strict psychoeducational evaluation that you would get in a school where they may do some questionnaires about anxiety, but it's really focused on what is this child's thinking ability, intelligence, and then where are their academic skills. So when you start to branch out into a larger evaluation, so a neuropsych evaluation really came from brain disorders, so brain injuries and brain disorders that affected thinking and learning. That was a way that we were able to understand the effects of that. And now neuropsych evaluations have become more often used when there's not a clear brain injury, but when there's sort of a neurodevelopmental disorder. And this is I could give a whole talk just on different types of evaluations.
I think we should do that because really it's so tough for people to figure out, It
is. And I actually, I did give a presentation a couple years ago sort of about this process and how to understand the differences and what is best for your child. And generally comprehensive, if you can do it, is always better, You have to weigh the time, the cost, and all of those factors, but the more data, the better.
Yeah, is it true here, for example, as a question, my 7-year-old son was diagnosed as ADHD and mood disorder, but I've seen some symptoms of ASD as well. The tests that he was given were just questions. How can I get a more detailed neuropsychological exam, and will insurance pay for it? So I think she's raising exactly what you're saying, that the more comprehensive the examination, the better. Is that primarily conducted by a psychologist then? And what's your experience with insurance?
So those are great questions, and I think this is also is that it varies, psychologist to psychologist what tests they're going to use, and so I think it's important as consumers to go into an evaluation asking those questions. How are you going to determine whether or not my child is on the autism spectrum? What tools are you going to use? So there's a lot of different tools. There are questionnaires that are just based on observations of parents and teachers. There are tests that we can use to observe behavior and compare it to other kids their age. There's history taking and reviewing records and development. So I think it's really important to ask those questions about how are you going to answer these questions? What are you going to use? So you can get a sense of, is this really as comprehensive as I need? And the bottom line is, as I said before, even the experts in the field are really grappling with how do you distinguish between these disorders. So you may go to two different professionals and get two different answers, So it's
there are a couple
really,
of people
really
who had that experience.
It's really challenging for parents. And as far as the insurance, that's another huge challenge. In my experience with my practice, I think it really varies by insurance carrier. So some insurance carriers will pay For some, will reimburse for an out-of-network evaluation, for example, at some level. Some will not. And then as far as what's covered by insurance, generally that's very, very limited. So for an example, an evaluation that I would do would involve almost 7 hours of direct testing with the child. An insurance, from my experience, what insurance will pay wouldn't even come anywhere close to that. So it's not, there are real challenges out there for parents that are trying to get this information, unfortunately.
Yeah, okay. I mean, general consensus that people would love to have a full hour on getting a good diagnosis, so maybe we can put that on the agenda. I just want to turn to medication. Lots of questions around, is it okay to treat ADHD with medication in a child that has anxiety disorders? Is it true that the only medications out there are for ADHD, that there is no medication for autism disorder or anxiety? So, I mean, I know those are big questions, but any general guidelines on medication for children who have both ADHD and autistic spectrum kinds of anxiety?
So, of course, my disclaimer is I am a psychologist. I'm not a medical doctor. I don't prescribe medication. So if you have specific questions, it's really important to go to your pediatrician or psychiatrist to get answers on specific medications, especially. But yes, that idea, there are no medications that are specifically treating autism. They're treating symptoms of the disorder. So they're treating impulsivity, they're treating aggression, they're treating behavior problems, or they're treating anxiety or depression. So we have different kind of categories of medications, and I think it's important. What I see in my practice is that kids that have combinations of symptoms or overlapping disorders tend to be more complicated to treat with medication. Sometimes, a medication for one symptom can kind of exacerbate another symptom. So you have to really work with a specialist and be patient with the process, because, kids can have some pretty challenging side effects and reactions at times. But I think as a whole, medications for kids, especially with complex profiles with multiple symptoms, medication can be such an important part of the treatment plan. It can be so helpful. And there are, sometimes it's sort of a little bit of trial and error as far as what do we think is most pressing here? Is the anxiety the most prominent symptom, and we need to really focus on treating that? Or is it that we really need to address the impulse control problems and the hyperactivity, and then the anxiety will come down? And then all of those things will then help social interaction. Does that make sense?
Yes. And I guess one of the clarifications is, in my understanding, you can treat both anxiety and ADHD at the same time.
Absolutely.
Some people that's been my personal experience in my own family. And there are people who have the impression that you can't, that's not possible. So just to clarify that.
Absolutely. There are children who their ADHD medication may also help with their anxiety. We talked about that cycle. And then there are also vice versa. The anxiety medication really helps them focus. So it's, and some kids end up on a medication for both, and that's really helpful.
Yeah, here's someone who says, we struggle with whether anxiety brings on inattention or vice versa. That sort of sums up the whole dilemma on whether we need to treat the ADHD with medication. So I guess another person says, we're visiting our son's pediatrician to discuss starting him on medication. He's been diagnosed with high-functioning ASD also. Do you have any advice for us as we begin this process? And if I understand what you just said, it's be aware that this is going to be complicated. You're going to have to spend time trying different medications and working it through with experts to get it right. Right.
Absolutely. Absolutely. And often parents are in a position that they need to do their own research. I mean, I think that's a general thing in our healthcare system these days. It's important for us to sort of be our own advocates, and certainly our children's advocates, and see, what the research is showing, what's helpful, what's not helpful, and looking at side effects. But it's certainly, sometimes it works out really well with the first medication, but sometimes it is a process.
Right. I'm going to just switch to the teen years, because there are number of people who are asking if you have any specific comments for teens, parents of teens, finding that some of the ADHD/autism social disorder problems become more severe in the teen years.
Mm-hmm.
Are there any, or more challenging, I guess, do you have any specific strategies that you would offer to parents of older children?
So as children get older, socialization becomes more complicated, more nuanced, and people sort of start to separate into cliques, so to speak. So it can be really challenging for kids with social differences. I think some of the same strategies in terms of figuring out what level of socialization is going to work for them. Are they really disappointed that they would love to be really social and have friends to do stuff with all the time, or are they really content with spending a lot of time on their own, but wanting on occasion to be with other people? So I would look at what are activities they can get involved in where there's an activity to focus on. It's not unstructured hanging out social time necessarily, but it's an activity that they can engage in while being social. So I don't know, I haven't spoken to anyone there in a while, but there was a place called the Autism Project where they have a lot of social groups and just social like hangout time that was in a more comfortable environment for teens. And all the teens there all had some struggles with social issues. So looking in if there are opportunities for social skills groups. In my area in Anne Arundel County of Maryland, there was a high school group of kids and parents that sort of got together and created ongoing meetings. And there's a lot in the autism community, especially with adults, where they've created online social communities and ways to interact that are more comfortable. And to find people with like interests, I think that's a key. And just, some of that social learning, I think often we don't teach kids how the social rules. A lot of them are unspoken. Right. So sometimes giving them really specific, concrete, these are the social rules. And there's a series of books, I'm blanking on the name right now, but I can, if anyone's interested, I can pass it along. And it's just these unwritten social rules. And
that would be great.
Yeah.
Okay. Yeah, I think the social skills are so challenging for many teens. Another set of questions come from parents who are seeing their children's anxiety or frustration come out as anger, serious anger, and from their children, and they have a really hard time getting past that anger to the underlying causes. Chris, is this typical, and what strategies can I use to help him handle his anger, knowing it's probably coming from his being anxious?
Right. So yes, that's the fight in the fight or flight freeze response. So when I'm working with families, and sometimes you do need to bring in a therapist, a psychologist, someone that can really work together with the parents and child to identify what the triggers are, what sort of setting up this situation so you can intervene before it gets to that level. So what I do when I'm working with kids is we use a thermometer idea for feelings. So when you start to feel anxious, maybe that was 3 hours ago when you got frustrated with a game you were playing, but it's only 3 hours later when your mom says, turn the game off or come to dinner, that there's an explosion because it was a buildup over time. So trying to sort of rewind the tape and find out where was there a point where the anxiety was at a low enough level that we actually could have intervened and redirected the situation. We could have talked through it, taken some deep breaths, use some type of strategy. Versus once they're in fight or flight, what I tell parents is often it's just damage control, keep everybody safe until it's over. And then hopefully you can debrief once things are calm. You can debrief what happened and maybe get to the root of it, but not always. Some kids really struggle with being able to identify their feelings. And that's another area that you can work on in therapy.
Okay, that's really a good one. I also wanted to recommend, I'm sure you know him, Ross Green. He did a wonderful webinar for us, The Explosive Child, which, and he has a wonderful book called The Explosive Child, which is all about trying to figure out that moment and heading it off ahead of time. And I think it's brilliant. For me, it was a real eye-opener when I heard him speak, sort of understanding. Someone is suggesting that perhaps the book that you might have been mentioning is by Jennifer Cook O'Toole, The Asperger Kid's Secret Book of Social Rules. That's the one that she's recommending.
Okay, great.
But I'll post that one just in case that's one. But everyone's very interested in hearing your suggestions for books on social that spell out the social rules. Yeah, a number of people. That is a wonderful, helpful book of social guidelines for kids. Great book. People are saying about Asperger kids. So,
great.
All right. Let me just see. So many questions. Cindy says, I can attest to the medication route. Our oldest son responded well. Someone else says, we've been trying for a year and we still don't have the right medication. So you've got, all kinds of experiences here. Let's see. What about antidepressants? Michelle, my son's on Vyvanse for ADHD, but the doctor wants to start him on Prozac as well. So I guess, it's best that you work with your doctor. I think you'd probably say that, right?
Right. And I think something that sometimes people are not familiar with is that a lot of, it's often the same medication that's used for depression or anxiety. So I would just clarify with your doctor, what is the medication? What is it intended to treat? So what's the purpose? Just be really clear on what's the goal of this medication. And then you could make an informed decision of whether it makes sense or not.
Okay. Yeah, here's an example. Someone whose psychologist told her that stimulants that are used to treat ADHD don't work with kids with multiple diagnoses. So that's just probably time to move on to someone else who has a more nuanced view of using medication.
I think, and the bottom line in this, what I want to impart to everyone is that each child is so unique. We really can't make blanket statements about anything, and especially with medication. It affects people so differently. But I've certainly seen in my own experience many children helped with all the disorders with medications.
So, Dr. Perlis, thank you so much. We're so grateful. It's hard for parents, all of us, to have kids with multiple diagnoses. This is a topic that we could, spend much more time in. I hope you'll consider coming back for a second round.
Sure,
And thanks, everyone. Thanks for tuning into Attitude. And thank you again to NEBA, our sponsor today. We're grateful for their support. Thanks and goodbye.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.
Whether you're looking to build a website for your business, your hobby, your podcast, or just for fun, Pair Networks is your go-to web hosting partner. Not only do we have the lowest domain price in the industry, starting at just $11, we've got hundreds of stunning website templates to help you stand out from the crowd. You're not a techie? Not a problem. With our easy DIY site builders, you can launch your impressive website without any technical know-how. And when it comes to security and updates, don't worry, we've got you covered. Our 24/7 US-based customer support is the best in the industry. Check out Pair.com today to learn more. PAIR.com.